Hello, everyone, and thank you so much for joining us today as we honor National Colorectal Cancer Awareness Month with our program, Get the Facts, Colorectal Cancer. My name is Melanie Harris, and I am joined here today with Dr. Loy, who will be our presenter. You'll notice that the console, or what you're seeing on your screen today, is completely customizable. You can reshape all of the windows that you see, and we encourage you to make any adjustments to optimize your experience. To temporarily remove a window from your screen, simply select the corresponding icon in the dock centered at the bottom of your screen and click on the icon twice. To bring the window back to your view, click once more. Further, if at any point your screen stops or you're experiencing a lag, you must refresh your browser window. You can do this by clicking on the circle with the arrow by your web address, or at the top of your page, click on the URL and hit enter. This should reload your page and place you back into our live experience. One more thing to highlight are the tools on your screen. Most important for you to use is the Q&A tool near the middle of your screen. During today's program, all audience microphones are muted. However, as Dr. Loy presents today's program, please don't hesitate to send any questions that you may have by typing them into that Q&A tool. We'll be sure to answer them at the end of our presentation, or we will follow up with you once the presentation has concluded. Again, thank you so much for joining us today. And now I am pleased to announce and introduce our presenter, Dr. Brie Loy. She is our Regional Medical Director out of Houston with over 16 years of experience as a board-certified physician in family medicine. She believes that a healthy patient-physician relationship begins with communication. She attended the University of Arkansas for medical science and completed her residency at St. Mary's Family Medicine. Dr. Loy enjoys working out and spending quality time with her husband and 2 dogs. So let's just go ahead and dive right into this program today. Thank you so much for being here, Dr. Loy.
Thanks, Melanie, and thanks for the introduction. Like she said, my name is Dr. Brie Loy, and I'm the Regional Medical Director for Partners in Primary Care here in Houston and actually Louisiana as well. Before we jump into the class today, I just want to start with a couple reminders. First, the class will be about 30 minutes. We will have a question and answer session and an open discussion session at the end. If you have any questions throughout the program, please type it into the chat box and I will answer at the end. All the information shared here doesn't replace professional medical healthcare advice. If you hear anything today in today's class that inspires you to make some sort of health or medical change, such as changing your eating habits or starting an exercise program, make sure that you talk to your doctor first. All right, so did you know that March is National Colorectal Cancer Awareness Month? It's an observance dedicated to encouraging patients, survivors, and caregivers to share their stories, advocate for colorectal cancer prevention, and inform others about the importance of early detection. That's why I'm here to share some very important information about colorectal cancer today. During today's class, you will learn about the basics of colorectal cancer, including risk factors for the disease and potential symptoms, colon cancer screening guidelines and your screening options, and tips to prevent colon cancer. I'd like to start with a poll. Please select true or false. Colorectal cancer is the second leading cancer killer in the United States. Did everyone select true? Of all cancers affecting both men and women, colorectal cancer is the second leading cancer killer in the US and the third most common cancer in both men and women. This is why it's so important that you're here today. Let's get started by learning what colorectal cancer is. Colorectal cancer is cancer that occurs in both the colon and the rectum. It is called colon cancer for short. As the drawing shows, the colon is the large intestine that surrounds all of the bowels, including the rectum. Sometimes we get these abnormal growths we call polyps. They're these little small outgrowths of tissue that occur on the inside of your colon. Over time, some of these polyps can turn into cancer. So the goal of having a screening test is to find these polyps early before they turn into cancer. The tricky thing about colon cancer is that colon polyps and colon cancer often don't have symptoms, especially at first. Someone could have colon polyps or colorectal cancer and not even know it. That's why getting screened regularly for colon cancer is so important. If you do have symptoms, they may include blood in your stool, stomach pain, aches or cramps that don't really go away, or losing weight and you don't know why. If you have any of these symptoms, you should see your doctor immediately. So let's watch this brief video from someone that may look familiar to you as to why colorectal cancer screening is so important.
Over the years, I have played some characters you could call controlling, but the truth is, there's so much in life we can't control. But here's something we can: colorectal cancer. It affects men and women, and it's the second leading cancer killer in the US, which is astounding, considering it's almost entirely preventable. Here's how. Most colon cancers start as polyps, and screening helps find polyps so they can be removed before they even turn into cancer. Screening also finds this cancer early, when treatment works best. For me, screening was simple and quick. It was no big deal, except for the huge sense of relief you feel afterwards. There are several tests that you can choose from. If you're 50 or older, you should talk to your doctor. Decide which one's right for you. But take control. Do everything you can to prevent colon cancer. Screening saves lives. It could really save your life.
So let's talk about the importance of screening for colon cancer. A screening test is used to look for a disease when you don't have symptoms. As I said earlier, colon cancer almost always develops from precancerous polyps in the colon. Some screening tests can find these polyps so they can be removed early before they turn into cancer. Screening tests can also help us find colon cancer early so that it can be treated. Colon cancer screening should start at age 50 for both men and women. The United States Preventative Services Task Force recommends regular screening for colon cancer for adults aged 50 to 75. If you are over 75, you should talk to your doctor about if continued screening for colon cancer is right for you. When most people think of colon cancer screening, they automatically think of a colonoscopy. And it's true, a colonoscopy is the best screening method. However, there are some other screening options that typically involve a stool test. Some stool tests, such as a fecal occult blood test or FIT test, can look for small amounts of blood in the stool that we can't see, but could indicate that you might have a polyp. This type of stool test should be repeated annually if they are normal. Another stool test called Cologuard looks for cancer cells in your stool. If this test is negative, it can be repeated every 3 years. A flexible sigmoidoscopy is an alternative to a full colonoscopy, but with this test, the doctor only checks the lower part of your colon for cancer. Because your entire colon is not getting screened, a flexible sigmoidoscopy needs to be repeated every 5 years if normal. Computed tomography, or CT colonography, also called a virtual colonoscopy, uses x-rays and computers to produce images of the entire colon. The doctor is able to see these images on a computer screen. It's not the same as seeing actual images within the colon that you would get with a colonoscopy, but if this test is normal, it needs to be repeated every 5 years. Like I said earlier, colonoscopy is still the best screening test for colon cancer since it lets the doctor look for polyps through the entire colon. Also, during a colonoscopy, if the doctor sees a polyp, he can remove the polyp during the procedure. After the polyps are removed, they are analyzed in the lab to see if they are normal, precancerous, or cancerous. The type of polyp will determine how often you will need a follow-up colonoscopy, but follow-up is typically 3 to 5 years if any abnormal polyps are found, and every 10 years if the colonoscopy is normal. Another thing to remember is that if any of the other screening tests we discussed today are abnormal, a colonoscopy is used as a follow-up to look for these polyps to see if we can figure out why we're having those abnormal test results. Let's take another poll. True or false? Only men get colorectal cancer. Did everyone answer false? As we mentioned earlier, colorectal cancer affects men and women of all racial and ethnic groups. Now let's look at the risk factors for colorectal cancer. Risk factors generally fall into 2 categories, those you can control and those you can't. Let's start with the risk factors we cannot control. The first is age. Your risk of getting colon cancer increases as you get older. This is why we start screening at 50% or at 50 years of age. 90% of colon cancer cases occur in people over 50. Another risk factor for colon cancer is family history of polyps or colon cancer. Certain genetic conditions can also increase your risk. So make sure you talk to your doctor about any family history of colon cancer. Finally, if you have any inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, you could also have a greater risk for developing colon cancer. Now, there are also several lifestyle things that can increase your risk of colon cancer. Some things you could do to decrease your risk of colon cancer over time include getting regular physical activity, maintaining a healthy weight, eating a high-fiber, low-fat diet rich in fruits and vegetables, and avoiding smoking and excessive alcohol use. Getting screened for colorectal cancer regularly is still the best way to prevent colon cancer. However, there are many things you can do between checkups to protect yourself. According to the CDC, research is underway to find out if changes in your diet can reduce your colon cancer risk. I typically recommend a diet low in animal fats and high in fruits and vegetables and whole grains that can reduce your risk of other chronic diseases such as heart disease and diabetes. This diet also may reduce your risk of colon cancer. To get started, aim for a half of your plate of vegetables at lunch and dinner, and include fruit with breakfast or snacks. Consider which grain products you could swap out for whole grain. For example, replace white bread with whole wheat, or try whole wheat pasta. Perhaps you want to try a new grain like barley or farro. Finally, to reduce consumption of red meat or processed meats like Spam or deli meat, consider trying alternatives such as ground turkey, ground beef, grilled chicken instead of steak, and tuna fish sandwiches instead of lunch meat. Researchers are looking at the role of some medicines and supplements in preventing colon cancer. The U.S. Preventative Services Task Force found that taking low-dose aspirin can help prevent cardiovascular disease and colorectal cancer in some adults, depending on age and risk factors. If you're concerned about your colon cancer risk, talk to your doctor about whether aspirin is right for you. As discussed earlier in the class, some of these risk factors for colon cancer include physical inactivity, excessive alcohol intake, and tobacco use. If you're not already physically active, talk to your doctor about increasing your activity. Walking is an easy activity to start, but remember, cleaning the house or doing yard work also count. Just keep moving. The CDC recommends adults to get 150 minutes of physical activity per week, which is 30 minutes per day. But this doesn't all have to be done at once. It could be a short 10-minute walk around the block 3 times a day. If you do decide to drink alcohol, do so in moderation. This is 1 drink a day for women and up to 2 drinks for men. Now, 1 drink is defined as 1 12-ounce beer or 1 5-ounce glass of wine or 1.5 ounces of hard liquor. Lastly, please talk to your doctor before you make any significant lifestyle changes to make sure that you're being safe and making the right changes for you.
Thank you so much, Dr. Loy, for being here today to tell us all about colorectal cancer. Now we're going to dive right into our question and answer session. So if you haven't done so already, please take the time to enter your question into that Q&A tool, and we'll do our best to get it answered for you by the end of today's program. And if we run out of time, have no fear, we'll follow up with you after. So let's just go ahead and jump right in. Dr. Loy, can you tell us a bit more about the at-home test kit?
Absolutely. There's actually 2 of the test kits that you can take at home. So the first is just that stool test kit that looks for blood in your stool, which is called a fecal occult blood test or a FIT test. So we can send that home with you. It comes with a little envelope and a little kind of package with some tissue and a little kind of stick to help you get a sample of your stool, so we don't want you making a mess of yourself. But you do that, you make a little smear on the card that's provided, you stick it in the envelope, and you can either drop it back off at your clinic for your doctor to read there, or you can mail it into the lab and then they'll send the results directly to your doctor's office. The second kind of test, which is called the Cologuard, the one that you can do every 3 years, it looks for cancer cells. So that one will get mailed to you directly from the manufacturer, but is very similar to the other test, where you're going to collect a stool sample, package that up in the envelope and equipment they give you, and mail it back. That again goes directly to your doctor's office, and they should notify you of the results.
Seems easy enough. It's come a long way. Yes. This next question we received, what do I do if I missed my colorectal cancer screening because of COVID-19?
That is a great question. A lot of things weren't happening last year because of COVID. You know, not a lot of people were getting colonoscopies. Things were shut down, and it was quite scary there for a while. Luckily, things seem to be getting better. And even if you can't get in to get a full colonoscopy, still starting with one of those screening tests is still a really good idea. So you can reach out to your doctor's office, you can call them and they can mail you a kit. If you're still not comfortable going into the clinic, we can send those to your house, or at your next doctor's visit, you can ask for them to give you a kit to go home with.
Great. Thank you so much. This next question is around the prep for a colonoscopy. Do you want to touch on that?
Yeah, I will say most people's biggest fear around a colonoscopy is the prep. And I'm not going to lie and say that it's really fun, because it's not. But they've made big improvements over the last several years. So I think most of us have this image of drinking these big jugs of really gross stuff. And now it's actually a much smaller amount and just a little bitty bit. It is, the point of the prep is to help clean you out so they can get a good look with the camera when they do the colonoscopy. So you probably will be hanging out by the bathroom most of the night, but just remember, the better your prep, the better view they get, and the better chance they find any colon cancer or those precancerous polyps early.
Yes, thank you for that reminder. This next question, is a colonoscopy painful? Do you want to touch on that?
Yeah, no, colonoscopies aren't painful at all. Actually, they kind of put you to sleep. So you're kind of groggy and don't really know what's happening. So it's always recommended that you take someone with you to drive you to the colonoscopy, because you'll need someone to drive you home. But like I said, the actual colonoscopy itself isn't really the worst part. It's that prep that everyone's afraid of.
Yes, that's what I've heard. So thank you for that. This next question is, if during my last colonoscopy they found a polyp, does that mean I have colon cancer?
No, so there are lots of types of polyps. Some of them are totally benign, and even if a polyp is found, you still won't need a colonoscopy for another 10 years. But there are those precancerous kinds, and those are the ones we want to try to find early. And depending what kind that is, when we get it back from the lab results, some people will need a colonoscopy every 3 to 5 years just to follow up. An interesting little fact is most of those little polyps in your colon, if they are precancerous, from the start of that little polyp to the time it turns into cancer is about 5 years. That's why we pick that frequency. So it's best to get in there early, find them while we can before they turn into cancer.
Yes, thank you so much. This next question, are there any foods I can eat that will help prevent colon cancer?
The biggest thing I recommend for preventing colon cancer, like most other cancers and just chronic conditions, is just a really healthy, balanced diet. So we want to eat low-fat foods, lean meats such as chicken or turkey, lots of fruits and vegetables. So, my general rule of thumb for lunch and dinner is to try to have about half of your plate with something green on it. Simple enough. And then for portion sizes, your meats and your carbohydrates, try to keep them around the size of the palm of your hand. Fruits with breakfast or snacks are a great alternative to some of the sugary, unhealthy snacks that we tend to eat. So just a really healthy, balanced diet is the best way to go.
Yeah, and in addition to diet, are there any other things that could help someone prevent colon cancer?
Yeah, like I said earlier, I think the other really big thing is as we get older, it's really important to stay physically active. That really keeps our overall health good and can definitely reduce our risk of colon cancers and some other types of cancers. So, we really recommend just 30 minutes of activity a day. And that sounds like a lot when you got to sit down and do one fell swoop, but you can break that up. And lots of times just regular housework, doing yard work, gardening, walking your dog, all of those things count. The key is just get off the couch and get moving.
Yes, very important. So we're shifting back a little bit to the colonoscopy itself. We've got a few questions that have rolled in here. So how long do the results take after a colonoscopy?
Yeah, the results don't take too long. I usually say a few days. They send those samples, like I said, if they take any polyps out, they'll send that to a lab. A special lab called a pathologist will look at them under a microscope to really look and see what kind of cells are in there. Are they normal? Are they precancerous? Are they cancerous? So it takes a few days for them to process that and get results back to your doctor. But I would say you should definitely have results within 1 to 2 weeks.
Great. Thank you so much. This next question, how often should I get a colonoscopy? I feel like you've mentioned it a couple of times, but just a reminder might be helpful.
No, it's fine. It kind of varies, but at a minimum every 10 years. We start at 50 and we go to 75 for routine screenings. Now, if you have a strong family history of colon cancer, we may want to start a little before age 50. So you want to talk to your doctor about that. And then after age 75, we kind of decide if you need to continue screening based on your overall health and risk factors. So that's when you want to talk to your doctor about. The screening is typically every 10 years if they're normal, or 3 to 5 if they find any of those precancerous polyps. But make sure you talk to your doctor to make sure you're going at the right frequency.
Yeah, so age does play into that for sure.
Yeah.
And then we've touched on some of the symptoms to be on the lookout for that might, push you into that pre-50 age range. Do you want to talk about some of those symptoms again?
Yeah, I think one of the trickiest things about most cancers, but particularly colon cancer, is for a lot of us, it doesn't have symptoms. And so that's why it's so deceptive and important to get those screenings to look for those things early. The most common one some people will see is blood in their stool. So that can be caused by lots of different things. But if you notice blood in your stool, you should definitely talk to your doctor about that to see if a colon cancer screening is appropriate. The other thing is, abdominal pain or stomach pain that just really doesn't go away. As I mentioned, as you get older, that risk goes up. So we want to talk to your doctor about that so they can kind of do an exam on you, make sure everything's going okay, imaging if they need to look for anything. But that's another one. And then another really distinctive one that I think a lot of people tend to forget about is if you're losing weight and you don't know why. If you're eating normal, you're still as active as you normally are, but you just keep losing weight, that's not necessarily a good sign. And we definitely want you to mention that to your doctor.
Got it. Thank you so much. We've got just a few more questions here. I am 75 and I've never had a colonoscopy. Do I need to get one scheduled?
I think that's one you should definitely talk to your doctor about. But general recommendation, if you haven't had one before and you're age 75, it's probably worth doing at least one screening just to make sure, depending on your overall health and other risk factors. But, I think at least one screening between age 50 and 75 is highly recommended. So talk to your doctor, but certainly, and here's the trick, Medicare will still pay for it.
Yeah. Thanks for that call out. So this next question goes back to, diet and supplements and vitamins. Are there any probiotics out there that can help prevent colon cancer?
I don't know that there's a lot of data around probiotics preventing colon cancer, but they certainly aren't going to hurt you. And especially for people that have kind of gas or bloating or constipation, probiotics can be pretty beneficial at helping kind of decrease those symptoms and just make you feel better overall.
Got it. Thank you so much. And this last question that we have here before we wrap up today's program is, how long after a colonoscopy does, would my life get back to normal?
That's a great question. It's actually not all that long. You'll probably be a little tired and sedated and a little gassy and bloated that first day after the procedure, but generally most people are back to eating normally and functioning normally within a day or so.
Great. Well, I cannot thank you enough for being here today to tell us all about colorectal cancer. And those screenings don't seem, too terribly scary. And so I hope our audience, found the same. And I can't thank them enough for being here and answering those really great questions. So thank you for spending a bit of your day with us. And we hope that you are ready to get that screening scheduled. Thanks again, Dr. Loy, for being here. And I hope everyone has a wonderful rest of your day. Thanks so much.
Thank you, guys.